Hi, I'm Russell Vinik. I'm Medical Director of GBS Benefits, and today we're going to talk about breast cancer screening. So, to start off, overview what we're going to talk about today, a little bit about breast cancer, and then we'll talk a lot about screening mammography, and then finally we'll look at the guidelines for breast cancer screening. So, breast cancer in the United States is the most common cause of non-skin cancer in women. It is the number two cause of death, of cancer death behind lung cancer, and very common. 1 in 8 women will develop breast cancer in their lifetime in the United States. Fortunately, it is less lethal than some of the other cancers, so a woman's risk of dying from breast cancer is lower, 1 in 43. When we catch breast cancer early and it's localized, then a woman is expected to have a 99% chance of living for 5 years. So early diagnosis and treatment is integral to preventing breast cancer death. Most women that are diagnosed with breast cancer do not have a known major risk factor, and this is why screening really focuses on populations and not just women that are at increased risk. So a little bit about risk factors. Age is a significant risk factor. Your risk of breast cancer goes up until you hit about age 80, and then it flattens and comes down. Inherited mutations, we've heard a lot about BRCA1, BRCA2. There's numerous mutations, BRCA being the most common, that significantly will increase a woman's risk of developing breast cancer. Family history, with or without those mutations, increases your risk. Previous chest radiation, people who've had radiation often for lymphomas, they're at higher risk of breast cancer. And then there's other modifiable risk factors, which increases a woman's risk about 1.1 to twofold. Alcohol consumption, obesity, type 2 diabetes, and then long-term perimenopausal hormone therapy with estrogen and or progestins. So let's talk about the benefit of screening. And this is where it gets very interesting. This data comes from a Canadian study and the Canadian Task Force of Preventive Healthcare. But this is really just looking at the number needed to screen. And so what we really are trying to do with screening for breast cancer is not just to find cancers, but to be able to impact a woman's life and prevent death from breast cancer. So when we look at the number needed to screen in younger women, age 40 to 49, one would need to screen a little over 1,700 people to prevent one breast cancer death. As women get older, as the prevalence of breast cancer goes up, then the number needed to screen to prevent a death goes down. So the screening is more effective as people get older when there's a higher prevalence of disease. Now, on top of that, and this is where a lot of the controversy comes in, is women that are younger have more dense breast tissue, and screening is not as effective in younger women. And so, number one, there's a higher false negative rate in younger women. There's also a higher false positive rate. And so this is why there is a lot of controversy, particularly in screening of women age 40 to 49. So looking at how often people actually get mammography, you can see that within the past 2 years, it varies by age group, and particularly that 40 to 44 age group, uh, just about 50% of women have had a mammogram in the past 2 years. As we get into the higher age groups where screening has been more commonly recommended, you can see that the screening is done close to 75% of the time, but also quite a significant variability based on a patient's race and ethnicity. So what is a recommendation now? And I'm showing you the United States Preventative Service Task Force recommendation, but recognize there are a lot of other recommendations out there, including the American Cancer Society, American College of Breast Surgeons, that are all slightly different. But the current guideline for women age 40 to 74 recommends biannual, so every other year mammography for those women who are at average risk. So there's certainly different recommendations for people who maybe have a strong family history or those who have positive genetic mutations. That's a different group of people. You can see that the USPSTF does not make a recommendation on people age over 75. And they also do not feel comfortable making a recommendation. What is the best screening? And should there be additional screening in women with dense breast tissue? Um, Other guidelines have different recommendations. Once again, this is where the controversy comes into play, particularly in younger women, where the sensitivity and specificity of mammography is less than in women age 45 to 75. So, just as a summary, at a minimum, average risk women benefit from biannual, every other year mammography starting at age 40. Some providers would recommend more common than every other year. In Canada, for example, they recommend every 2 to 3 years. But the United States Preventative Service guideline, every 2 years, starting at age 40 up to age 75. But once again, breast cancer screening is complicated and personal, and this is really worth a discussion between you and your healthcare provider. So I really appreciate you joining me today. Again, I'm Russell Vinik with GBS Benefits, and we look forward to seeing you soon.